this is Dr. Rudhra from Department of Periodontics. I am an assistant professor. Today our lecture is about gingival inflammation. So what is this gingival inflammation? So in this topic you will understand what is the etiology, pathogenesis and clinical features and the underlying histological features which can correlate with the clinical features. So in this topic, what is gingival inflammation? So the learning objectives of this lecture are definition. We will understand the etiological types and the stages of gingival inflammation. We will also analyze about the pathogenesis and molecular mechanisms about it, and we will recognize the clinical features. We will also list out the histological features which is correlating with the underlying clinical features. We will also understand the relevance in periodontal disease progression, which is going to help in our treatment. So what is this gingival inflammation? Before going to gingival inflammation, we have to understand what is inflammation. So inflammation is the body's immunological response to any external agents or any injurious agents. So these external agents can be microbial organisms or foreign substances. So for this inflammation to occur in the gingiva, it is termed as gingivitis, which is called as inflammation of the gingiva. So this is termed as a localized immunological response which is pertaining to the gingiva to the external agent, which is the bacterial plaque accumulation. So this bacterial plaque accumulation is the form of biofilm. So this biofilm is a collection of microorganisms which is formed by the co-aggregation and colonization phenomenon. So to this response of the bacterial plaque accumulation in the oral cavity, inflammation of the gingiva occurs, which is termed as gingivitis. So why it is important? This is recognized as the earliest sign of periodontal disease. So periodontal disease, we have various types which is starting from the gingivitis to the periodontitis and various types of periodontal lesions. So here the starting point is the gingivitis. So it serves as an, so this gingivitis serves as an earliest sign of periodontal disease progression. And why this is important? This serves as a warning sign and it helps us to understand the host microbial interactions. Here the host tissues is our periodontal tissues and the microbial interaction is with the bacterial plaque accumulation. So these two interactions helps us to understand the inflammatory pathways of the gingiva. And if this gingivitis condition, if this is untreated, it can lead to more serious form of periodontal disease which is called as periodontitis, that is the breakdown of periodontal structures leading to tooth loss and bone loss. So next is the types of inflammation. So this is categorized as acute and chronic. This acute form of inflammation is immediate reaction and it is short duration to the external agent. So this is categorized as underlying pathogenesis as the mediated by the first defense cell which is called the neutrophil. This neutrophil is mediated initially by the initial vascular response which is characterized as vasodilation and increased vascular permeability. So following these two reactions, there is infiltration or recruitment of neutrophil which is going to initiate the acute inflammatory reaction that is going to cause the inflammation of the gingiva and helps into removal of microbial pathogens. And if this inflammation pathways or underlying molecular mechanism is going to proceed for a longer duration, it goes into a condition called as chronic inflammation. So in this chronic inflammation, the main inflammatory cell which is going to play in the role is adaptive immune cell, which is the T and B cell and also macrophages. So this is going to perform an n number of cytokines or inflammatory response or inflammatory proteins which is going to cause the destruction of underlying periodontal structures. So here the main inflammatory mechanism of the tissues which is undergoing is the granulation type of maturation. So next, coming to the etiology of gingival inflammation. What is the primary etiology? Is dental plaque. So dental plaque, it is a form of dental biofilm that is formed by the co-aggregation and colonization mechanism of the microbial biofilm composition. So this plaque is going to initiate the host interactions and that is going to cause the inflammatory reaction. So, increasing this plaque also it is mediated by the contributing factors. So these contributing factors mainly involves local and systemic. So in the local contributing factors we have calculus, overhanging margins or restoration, improper prosthetic restorations or malaligned tooth or crowding which is going to cause the improper oral hygiene. or any mouth breathing habit which is going to cause the dryness and increase the plaque accumulation. So, these are the contributing factors which is going to increase the plaque accumulation. And other systemic factors which is going to increase these accumulations are hormonal changes. Any hormonal changes which is going to increase the inflammation pathways or microbial composition such as puberty, pregnancy, menstruation cycles, or this is due to the, especially due to the increased vascular response in these stages. And also drugs, external drugs which is going to cause the plaque accumulations are phenytoin, cyclosporin, calcium channel blockers. So, these drugs are going to affect the nuclear replication of the gingival tissues or periodontal tissues, which is going to increase the which is going to disturb the well organized structure of the periodontal structures, and that leads to secondary inflammation. And other systemic diseases like diabetes, leukemia, or impaired host response is also going to disturb the normal well organized pathways or homeostatic pathways of the gingiva. That is also going to increase the gingivitis condition. And other deficiencies, nutritional deficiencies like vitamin C deficiency, iron deficiency, or any B complex deficiency is also going to affect the texture of the gingiva, that is going to increase the inflammatory pathways. So, these are the systemic contributing factors which is going to affect the gingiva and leads to increase in inflammation. The main plaque organisms which is going to cause the initial stage of inflammation are gram-positive cocci and rods, and also anaerobic conditions. So, these organisms are the have a major role in gingivitis condition. So, next we will see about the classification of gingival inflammation or gingival diseases. So, this is according to the standard definition which is given in 2017 by American Academy of Periodontology. So, this is categorized as dental plaque induced and non-plaque induced. So, in the plaque induced, as we said earlier, it is mainly because of the dental plaque only or due to systemic and local contributing factors. And non-plaque induced conditions, some conditions which does not increase the microbial composition or affect the microbial composition, but can also increase the gingival inflammation. It will only causes the inflammatory pathways to exceed, but it does not alter the microbial composition associated dental plaque induced inflammation. So, these conditions are bacterial, viral, fungal infections, and genetic infections or trauma or foreign body reactions that is going to directly cause the inflammatory reaction without the involvement of microbial or host microbial interactions. So, next we will understand the pathogenesis pathways. So, the first culprit is being the biofilm. So, this biofilm starts by attachment of microcolonies into the oral structures which involve the tooth and which is the hard and non-hard structures of the oral cavity, and this next goes to the next stage of formation of microcolonies, and this again next goes to the stage of formation of extracellular matrix. So, this component plays an important role for the survival of microorganisms by providing the nutrient supply and water channels for the microbial growth, and this leads to maturation phenomenon of biofilm dispersion that is going to increase the plaque accumulation by colonization and co-aggregation mechanisms. So, this is how the dental plaque formation occurs. So, followed by this we have the underlying host mechanisms. So, to this biofilm or plaque formation, our host gives a response, immunological response. So, those response can be in the term of healthy condition or unhealthy condition. So, in the healthy condition, it will lead to the microbial biofilm will maintain a standard called as homeostatic polymicrobial biofilm. So, this state will have mostly the commensal organism, which is a good bacteria for the host tissues, which will maintain the healthy state of the periodontium. So, in this healthy state, we will have a healthy gingiva and healthy bone level. So, if there is an incorporation of any perturbed or disturbed polymicrobial biofilm with the incorporation of gram-positive anaerobic organisms or cocci or rods, so then it will elicit the host responses. Host immunological responses will be elicited. So, those responses is mainly mediated by the neutrophils and vascular response. The first response will be vascular. So, those responses are vasodilation, increased vascular permeability, and endothelial alterations. So, with these alterations, the first cellular infiltration take place. The first cell which is being recruited is the neutrophil. Once the neutrophil come into the target site or into the inflammatory area, it will increase the process called as phagocytosis. So this phagocytosis is going to kill the bacteria which is disturbing the healthy state of the gingiva, and this phagocytosis also release some free radicals or reactive oxygen species that is going to harm the tissues. So hence, after the removal of pathogen or microbial organisms, this neutrophil has to be suppressed. So this has to go to the next stage of neutrophil apoptosis, that is going to be mediated by the macrophages, which is the another type of inflammatory cell which is going to maintain the homeostatic inflammatory mechanism. If this stage is skipped, then it will go to the chronic inflammatory stage, that is called as periodontitis. So this neutrophil apoptosis is an important mechanism to maintain the balanced host defense mechanism. It clears the infection and also resolves the inflammation. So if this acute inflammatory lesion goes to the dysbiotic stage, which dysbiosis means incorporation of various pathogenic microorganisms, which is mainly the gram-negative anaerobes, obligate anaerobes, red complex organism, which is going to trigger the hyperinflammatory response. So this dysbiotic condition, if it come into the role of the oral cavity, then it leads to a imbalanced host defense mechanism. So in this imbalanced host defense mechanism, we are going to have an uncontrolled neutrophil recruitment, uncontrolled adaptive immune cell responses, and uncontrolled complement activation. So these three steps is going to increase the hyperinflammatory state and increase in release of cytokines. So this is going to destroy both the pathogen as well as our host tissues, which is going to cause the attachment loss and bone loss. So this is a state of chronic inflammation, which is the periodontitis state or imbalanced host defense mechanism. So this is the main understanding of the pathogenesis of gingival inflammation. So this is next categorized as stages of gingival inflammation based on the histological and clinical feature. So this was mainly given by Page and Schroeder model. So nowadays we have various types of models that has come into the role. Till 2025 we have a description of various models of pathogenesis of inflammation in the periodontium. But this Page and Schroeder model has become the standard in Karensa book, which is helpful for the undergraduate and for the simplified versions of understanding. So in the stages of gingival inflammation, we have initial, early, established and advanced lesion. So this is going to categorize the disease progression of the periodontium. So this table is being important for the exam point of view for categorizing the stages of gingival inflammation. So this stages has been started with initial lesion. So here the time frame is 2 to 4 days. So this happens within 2 to 4 days from the plaque accumulation stage, and histologically we have changes such as vascular response, so which is the vasodilatory phenomenon and increased vascular supply with the next stage of neutrophil recruitment. But clinically we doesn't have any features of inflammation. So inflammation features or signs doesn't reflect in this stage. So hence this is called as subclinical gingivitis. Only histologically inflammation is happening, but clinically there is no response. Hence it is called as subclinical gingivitis. So which is the initial form of lesion or mild gingivitis. So here the main cell which is going to play a role is neutrophil. And next stage is the early lesion. So this is going to happen 4 to 7 days from the plaque accumulation after the initial lesion. Here the main histological responses are neutrophilic response, lymphocyte infiltration, and also there is alteration in collagen formation. So collagen is an important structure for periodontal fiber formation and gingival fiber formation. So if this is dysregulated, then this makes the easier penetration of inflammatory pathways to go into the underlying structures. So here the clinically we will have a first sign, which is the bleeding on probing. This is very important. Bleeding on probing is the first sign of gingival inflammation, which is going to start in the early lesion of gingival inflammation, and here the dominant cell being the T lymphocytes with the macrophages and neutrophils. And next stage is the established lesion. So this is going to happen within 14 to 21 days from the dental plaque accumulation. Here the histological features is mainly predominated by the plasma cells. So this plasma cell is a form of B lymphocyte which is going to elicit a poor antibody response to the external agents. If there is a poor antibody response, there will be more pathogenic form of microorganism which is going to infiltrate the tissues, and it is going to cause the inflammation exceeding till the deeper connective structures. So this is going to play a role in the established lesion. and also there is alteration of the epithelial structures. There is loss of retipex or hyperinflammation of inflammatory cells into the connective tissues, vasodilatory mechanisms, fibrotic mechanism, everything is going to happen in the established form of lesion. So here clinically we can see an obvious gingival redness, swelling, bleeding on probing, changes in color, contour, consistency, every part of the tissue is going to be affected in the established form of lesion, especially pertaining only to the gingiva, not to the underlying structures, underlying deeper connective tissue structures. So here the dominant immune cell is mainly the plasma cell. And next to the advanced lesion, as the term implies, the lesion has gone into the advanced deeper structures or deeper connective tissue structures. Here, so this chronic inflammation is going to take place with the weeks or months or years, and here we can characterize the apical migration of junctional epithelium. Junctional epithelium, which is the attachment of the gingiva to the tooth structure, is going to alter and it is going to proliferate apically, causing the pocket formation or deeper pocket, bone loss formation or loss of attachment. So these stages are going to happen in the advanced lesion, which is categorized as a periodontitis, that is inflammation of the periodontal connective tissue structures. And here the dominant immune cell is being plasma cells and B lymphocytes. So next we will come to the clinical features of gingival inflammation. So here this can be easily remembered by the 3 C's mnemonic we can use for it. So here we are going to understand the color, contour, consistency, and the first sign being bleeding on probing, along with the changes in surface texture. So these are the main 5 clinical symptoms or signs of the gingival inflammation. So from the color perspective, here healthy gingiva will have a pale pink color, but due to the gingival inflammation, due to the underlying vascular responses, it is going to turn into a reddish or bluish red color due to the vasodilatory phenomenon. And next being the contour of the gingiva. So the normal contour is scalloped gingival margin with knife edge interdental papilla. So that is going to be altered with the gingival inflammation. So in the picture you can see the altered contour of the gingiva, which is the blunt interdental papilla with rolled out or bulbous gingival margin. So there is a bulbous gingival margin and the rolled out interdental papilla. The consistency is going to change from the firm fibrotic consistency to a soft edematous or spongy consistency. This is because of the accumulation of the fluid or edema formation, which is going to take place in the inflammation pathways. So that is going to change the consistency of the gingiva, which is soft, edematous, spongy in consistency. Next is the surface texture. So the normal surface texture or the healthy gingiva will have a stippling formation, which is the orange peel appearance, which is going to indicate the underlying well organized structure of the gingiva. So that is going to be absent in the gingival inflammation. So there is an absence of stippling in the gingival inflammation because this plaque or microbial organism is going to destroy the normal architecture of the epithelium and the connective tissue. Hence the surface texture is going to get altered. So these are the main clinical features of gingival inflammation or gingivitis. So here we can categorize about the difference between the healthy versus gingivitis condition. So in the picture, as you can see, in the healthy state we have a pale pink structure with a scalloped gingival margin and a knife edge interdental papilla seen with the proper stippling with an organized epithelial and connective tissue structure. So this is the healthy state of the gingiva. Whereas in gingivitis, which is the inflammation of the gingiva, it is going to have an changes in color, which is the reddish blue or reddish in color of the gingiva with an altered gingival margin, which is the bulbous gingival margin or rolled out gingival margin with a blunt interdental papilla, and then absence of stippling. When we probe, we will also have a bleeding on probing or history of brushing during bleeding. So these are the inflammatory condition of the gingiva, which is going to be reflected both in terms of signs and symptoms. So how can you correlate the clinical and histological features? So histologically, we have underlying vascular changes, cellular changes and epithelial changes. So in vascular changes, we have vasodilation and increased vascular permeability phenomenon which is going to happen. and these changes is going to recruit the inflammatory cells into the needed area, which is the target site. So those inflammatory cells will get recruited onto the plaque accumulation area or microbial organisms area, which is going to elicit the immunological responses. So those cells, which is the neutrophils or lymphocytes, it's going to exaggerate the inflammatory response into the target area, that is going to cause the inflammation of the gingiva. So in the early stages we have PMNS, and late stages we have macrophage and lymphocyte phenomenon. And next, coming to the connective tissue changes and epithelial changes. So connective tissue, we have loss of collagen fibers and more infiltration of inflammatory cells, whereas in epithelium there is proliferation and ulcerative phenomenon is going to happen, loss of retipex, and architecture is going to completely change, which is going to cause the changes in alteration of consistency and surface texture of the gingiva. So how can we correlate the clinical and histopathological feature? We'll discuss about a case. So first, panel A is the anterior gingiva, which is having a marginal gingivitis. So this is being clinically reflected as an reddishness and swelling on the marginal, pertaining only to the marginal gingiva, and here the main contributing factor is being the dental plaque. So this is a clinical picture of a case. And next clinical case is the posterior gingival inflammation, that is mainly caused by the dental plaque accumulation as well as the root stems. So here the root stems or caries formation is going to be a contributing factor for the more aggressive version of the dental plaque, and this is going to cause the more inflammatory phenomenon and swelling phenomenon in the posterior structures. So along with this patient also have an improper oral hygiene habit with a more aggressive brushing habit, that is also going to injure the gingiva and also contribute for the increased inflammatory factor, and which is going to alter the gingival architecture of the periodontium. So histopathologically these two cases can be characterized as, the first D panel is going to be the mild gingivitis, which is depicted in the first picture. So here histologically that is depicted as an proper epithelial architecture is maintained, but there is incorporation of neutrophils onto the connective tissue area. In the connective tissue area we can see the double-edged sword neutrophil structures into the connective tissue. So this is categorized as mild gingivitis, whereas in panel E we can see the, so because of the diffuse inflammation in the second case, so this histological features also depicts the same. So histopathologically the epithelial structure is totally altered, there is loss of retipex, there is an areas of proliferation and ulceration we can also see in the histopathological picture. And also in the connective tissue we can see the n number of inflammatory cells, which is the neutrophils, lymphocytes, B cells, T cells, everything has been incorporated into the connective tissue with the changes of fibrotic phenomenon in the inflammations, because the chronic inflammation can also induce a fibrosis phenomenon. So other than this gingival inflammation, we also have various types of gingival disease structures. So those inflammations are, first is the inflammatory type as we discussed earlier, and second type is hormonal induced. So puberty, pregnancy, menstruation can also induce the gingival inflammation without the involvement of dental plaque itself. And in drug induced gingival overgrowth, which is caused by the phenytoin or cyclosporin or any other immunosuppressant forms, so that is going to reduce our immunological response and increases the inflammatory reaction to a normal homeostatic or perturbed microbial phenomenon. And next is the nutritional deficiencies or any infectious lesions, which is also going to disturb the gingival architecture or inflammatory pathways, because to the minimal microorganisms itself they will react more in a more exacerbated form of inflammatory lesion. And next being the neoplastic lesions or any genetic or developmental lesions which can causes an hyperinflammation or hypergrowth in the gingival structures, or any systemic disease manifestations which can also contribute for the dental plaque association. And then traumatic or reactive lesions, foreign body reactions, all these are going to cause the inflammatory reaction without the involvement of microbial pathogenesis. So next, why the early diagnosis matters. So gingivitis is a reversible condition, and this when we early prompt diagnosis can alter or reverse the condition into a healthy state without the future periodontal breakdown. It will reduces the risk of attachment loss or bone loss. It will maintain the oral health in a more proper way, which is going to increase the longevity of the periodontium, which is going to be an important part of the oral structures or dental structures. So early diagnosis can also improve the patient prognosis and quality of oral health, quality of life. So what are the key steps in management? The first key step is the clinical examination. We have to assess the color, contour, consistency, bleeding on probing, and then probing depth, and also the symptoms which is said by the patient. They can also report the brushing during bleeding, improper brushing habits, burning sensations, or tendon percussions, or foul smell. This can be reported by, these things can be reported by the patient, which is helps us to assess the initial diagnosis part of the gingivitis. So we also have to evaluate the contributing factor, the main factor being the plaque and calculus, and also the overhanging restorations or any improper restorations or any other factors which is going to be present or contribute for the plaque accumulation. So this has to be diagnosed and has to be managed in phase 1 therapy. And second part being the oral hygiene education. After the removal of the etiological factors which is causing the inflammation, we have to properly educate the patient regarding the oral hygiene, about the emphasizing the brushing habit, and assessing the initial symptoms or signs, and use of any antimicrobial mouth rinses, which is going to reduce the inflammatory pathways in the inaccessible areas. So next is the professional mechanical therapy, which is the scaling and root planing, that is going to remove the etiological factors which is causing the inflammation, and periodic recalls and maintenance is important in order to assess the periodontal disease progression. We should also address the modifying factors as we discussed in the differential diagnosis, which is being the nutritional, systemic deficiencies, genetic factors, and then any traumatic lesions or any neoplastic lesions. All the contributing or modifying factors has to be addressed in order to reduce the recurrence or in order to maintain the healthy state of the gingiva. So coming to the summary or conclusion part of this lecture. So gingival inflammation is the earliest and common sign which is going to affect the which is going to affect the periodontal structure, that is termed as gingivitis condition. And here the plaque is being the more primary etiological factor for causing this disease, with the associated contributing local or systemic factors. And here in this lecture, the most important part is being the stages of gingival inflammation, which is given by Page and Schroeder. Here we have to discuss about the time frame, histological and clinical structure, and we also have to discuss individually about the clinical symptoms and histological changes of the gingival inflammation. And the prompt early diagnosis, very important for the early management and reverse. Since this is a reversible condition, we can also change this gingivitis into an healthy state without being progressing into the periodontal destruction, because once periodontium is destructed, it is very difficult to regain. And so the takeaway message of this lecture is a healthy gingiva is the foundation of the periodontal health. So early prompt and early diagnosis plays an important role in maintaining the overall or oral health quality of life. So these are my references which you can take it for reference. Thank you.